So with Hep C, it's almost identical to Hep B. Slow down replication of the virus, increase your body's immune response to the virus, and keep your fingers crossed that you can either, with those medications, help clear the infection or at least keep yourself from going on and getting worse and progressing. If you do progress, again, the two big risks are either cirrhosis and liver failure, at which point you need a new liver and you get transplanted, or liver cancer. Um, you know, uh, Ideally, you want to try to clear the infection, which is getting better at doing. Um, your middle of the road option is living chronically with the infection but having it not progress, which is, by the way, kind of where we are at with a lot of patients who have HIV, where we're getting to keep people living with the infection but not getting worse with it. Not a great situation, but um, improvement. Autoimmune hepatitis. This is like the other autoimmune diseases. Your goal is to increase the amount of time somebody is living with the disease and keeping it from progressing and keeping the body from attacking itself and specifically that organ. You're going to get a lot of side effects from the medications that you're taking, but you would rather at this point have the side effects from all of those immune suppressives than having to have somebody lose the organ. So it's steroids, immune suppressive medications, and if these fail, unfortunately, you know the endpoint. It's liver transplant, and you're going to see why I'm making a face here in a little bit. With Nash, it's weight loss and improved diet and improved lifestyle modifications. No medications for this. There are no other treatments. And usually, by the way, that works. Even if you get Nash hepatitis, and I don't know the percentage, but the vast majority of patients with the appropriate modifications, even if your liver is inflamed, improve. And they go on to, they get better, their liver gets a little sick, it repairs itself, and you're fine. Full on fulminant hepatitis is rare, but it does indeed happen. And if it does happen and you wind up with full on Nash hepatitis, and you go on to liver failure from that, the endpoint's the same: liver transplant. Get on the transplant list, hope and pray for a new liver. Finally, last one: alcohol induced hepatitis. And by this point, you know the drill. Stop drinking. Stop drinking yesterday. Um, get help, go into therapy, get a support group. If you do and you catch it early enough and your liver is not sufficiently scarred and then has not sustained long-term damage, your liver should regenerate enough and you should go on to have close to a normal lifespan. If your liver has suffered enough damage, you should at least get to keep the one you have for a while. But if not, cirrhosis, liver failure, transplant. There are no other treatments. There are no medications to treat this. So by now, here's the upshot of all of these, is that if you have damaged your liver sufficiently, with hepatitis A, B, C, or hepatitis B, C, and D, some people will go on to have liver cancer, and that treatment line will take you down like it does for cancer, surgery, chemo, radiation. Everybody else, you're going to wind up on the transplant list. The issue is there are more people needing transplants than there are livers available. So the issue is, there's not enough help for everybody that needs it. So a lot of different causes. Most people get better regardless of the cause. Worst case scenario for all of these causes, the endpoint is the same, and there's not enough livers to go around. Thank you for your time. Sorry to end on a depressing note.